Okay, this is the sensory motor integration techniques video. My name is Jessica Branham. So first I will start with the labial inhibition points. So these are right here around the mouth. There, pressing these spots. So if you were hypertensive, you would apply deep pressure. And for hypotensive, you would use tapping to stimulate the movement, right around there. So first we will start with the technique to purse the lips. So I have a frozen glycerin swab here. So I will go around the mouth in a clockwise motion. So there we go. And I'll go in a counterclockwise motion. Okay, so now pucker your lips like that. Okay, so now let's try some sounds. Can you try two?
Two.
All right. So now moving on, we'll do the technique to retract the lips. So I'm going to take the frozen swab again, and we will go across the lips. I think that's just laughing. And then we will do small strokes inward towards the mouth, like this. All right, and now you can smile for me. Okay. All right, now we'll move on to stimulate unilateral weakness. So we're again going to go in a clockwise motion, and then we will do, on the weaker side, we'll do short strokes away from the mouth. So there we go. And then say this was the weaker side, we would do these short strokes away from the mouth. Okay? So now I'm going to get a new glycerin swab. And now these techniques will be inside the mouth. So now we're going to do one to increase the palatal reflex. So this is one that you would want to do to wake up the receptors if the client was about to swallow a bolus or something like that. So, can you open your mouth, please? So I'll be in the back of the mouth, and I will glide the swab horizontally across the soft palate. So can you lower your tongue a little bit? Okay, and so if the left side was the weaker side, we would start over there. Yeah, so we can see a little lift there. Here, I'll hold this. All right, and I'm sorry. We're going to try one more time. And there, I can see the lift there. Sorry. All right, now you can swallow. Here, and I'll wipe your mouth for it's kind of wet. Okay. All right. So here's another one to increase the palatal reflex. So we're going to do vertical strokes instead of horizontal this time. All right, so now we're going to stroke. Oh, yeah, I can already see it lifting. I'm sorry. Okay. Sorry. Okay, you can swallow. Okay, can we try it one more? Oh, yeah, okay, you're done. Sorry. Okay. All right, and now we're going to increase tongue-based retraction. So again, we would go from weaker to stronger side. So we're going to go left to right this time. And so I'm going to glide this along your like bitter taste buds. Okay. So this is going to, this is going to initiate the swallow reflex. Can you lower your tongue? Yeah, okay. Yeah, so we could see that the tongue base did retract. Okay, so now we will go on. There's another technique to increase tongue base retraction. And it's kind of like the one that we did earlier, except we just do one swipe. So I'm going to have you open your mouth again. All right, here, I'll take the camera. Okay. Well, actually, can you hold it right here? Yeah, that's perfect. Okay, now I'm gonna kind of hold. Can you lower your tongue for me a little bit? There. All right, kind of, oh, there we go. Oh, down, sorry. Okay, so let's try one more time. I'm sorry. Okay, I did see the back lift there. And I did see the base of the tongue relax, or retract, sorry. Okay, so now we will go on. I'm gonna get a new glycerin swab. So now we will do the lingual curling response. So here I will take the swab and I will just go down the middle of the tongue, and this should make the edges of the tongue curl. So stick your tongue out a little bit. Yeah, there we go. So there we can see the tongue starting to form a bowl shape. There we go, yeah. Okay, so now we want to reduce elevation in the posterior area of the tongue. So I'm going to use long strokes with the glycerin swab, and I don't want to touch the lateral edges. So this is going to keep the tongue depressed. So kind of relax your tongue. Yeah, there we go. 1, 2, 2, 3, 3, 4. So that did help kind of lower the tongue there in the back. Here, I'm gonna hold this and we're gonna try it one more time, okay? So, let's see here. 1, 1, 2, 2, 3, 3, 4. So it is lower than it was before. Okay, thank you. All right, so now we want to elevate the tongue tip. So we're going to take the tongue depressor now along the lateral edge of the tongue, which is the transverse muscles. That's where we want to focus. And we want to use long, quick strokes. We don't want to touch the center of the tongue. And then we're going to brush up on the tip of the tongue. So open your mouth, please. A little bit more. Let's get a little bit closer. Okay. So we're gonna do 1, 1, 2, 2, 3, 3. And we're gonna kind of brush up, and you can see the tongue tip lifting. And then I want you to take your tongue and kind of, yeah, right like that. So you can see the tongue tip lifting up there. Okay, just a few more. Okay, and this one is also to elongate and elevate the tongue. So we are going to do some long strokes and then some short rapid strokes. So open your mouth again, please. And we're gonna go here, here, 2, 2, and then some short rapid strokes. All right, and we're gonna try that one more time. So we're gonna do 1, 1, 2, 2, and we can see the tongue kind of elongating. And yes, there, and it's trying to lift there. Okay, so now we're going to do one that is done on the back of the tongue. So I'm gonna have you kind of lift your tongue up, if you can, yep. And I'm going to stroke upward, 2, 2. And then I can give a little bit of pressure if that's needed, but where he does not have any issues or weakness with his tongue, the pressure isn't really needed. And the last one, so we want to reduce lingual deviation. So if you had a weaker side, that's the side that we would do the short rapid strokes on. So we're going to go down the edges of the tongue, and then we will do the short rapid strokes. Alrighty. So we'll do these short rapid strokes and say this is the weaker side. Do this and then some. around the tongue tip. So we'll do that one more time. Stick your tongue out just a little bit more. Okay, thank you. Just around the sides. We can see that it does stimulate movement in the tongue. All right. So those are all of the integration techniques that we were to perform for this video. Thank you.